assistance sector. I'm Stephanie from WorkSafe Tasmania, and I'll be your moderator today. In recognition of the deep history and culture of this island, we acknowledge Tasmanian Aboriginal people, the original and continuing custodians of the land, sea and sky. We acknowledge and pay our respects to all Tasmanian Aboriginal people, all of whom have survived invasion and dispossession and continue to maintain their identity, culture and Aboriginal rights. We now ask that you take a moment to read the following slide about information received today. Please use the chat window on your control panel to type and submit any questions for today's presenters. Those questions will be answered at the end of today's webinar. Only presenter webcams will be used during this presentation, and today's webinar is also being recorded. It is now my pleasure to introduce your presenters today. Michael Walsh and Marcia Pegg from GIO Workers' Compensation and Dr. Mary Wyatt from It Pays to Care, Royal Australasian College of Physicians. Michael is the Manager of Risk Management Solutions at GIO Workers' Compensation. He has over 22 years' experience in workplace risk consulting in various industries across Australia: education, mining, transport, construction and healthcare. Michael holds a master's degree in health and safety and professional chartered qualifications, which provide him with a strong understanding of workers' compensation schemes and regulatory requirements. Marcia is the Executive Manager of Workers' Compensation for GIO in Tasmania, ACT and Northern Territory. With over 26 years in the insurance industry and 16 years with GIO, Marcia has experience in customer service, employee engagement and people management. Marcia is an accredited injury management coordinator with a diploma in injury and disability management, focusing on high and medium risk claims, injury management solutions and return to work strategies. Dr. Mary Wyatt is an occupational physician involved in policy development and research with the Australasian Faculty of Occupational and Environmental Medicine. Mary is dedicated to translating research into practical applications. Mary leads the initiative It Pays to Care under the Health Benefits of Good Work policy by the Royal Australasian College of Physicians, advocating for evidence-based practices in work injury schemes. And we welcome our presenters today.
Excellent. Thank you very much, Stephanie, and I appreciate the opportunity to come today to present on this important topic and sharing our insights and thoughts from GIO. Just a bit about us and GIO. We are a national insurer, are part of the Suncorp Group, and we operate in multiple states, both across underwritten workers' compensation, managed fund, and also CTP in the personal injury insurance as well. As you can outline here, we do have quite a fair market share across each of these states, but specifically in Tasmania, we represent about 20% market share. And today, a lot of our insights are being drawn from our portfolio within Tasmania. So appreciate the opportunity to discuss those insights. When it comes to healthcare, healthcare in Tasmania and our customers in Tasmania, we do quite a few customers that sit and operate in this industry. And over the years, since 2019, GIO have managed over 10,000 workplace injury claims, just specifically in Tasmania. And with that, 30% of all those claims that are submitted within our portfolio come from the healthcare and social assistance industry. So it's definitely makes up a good representation of the injuries that we do manage. Just drawing upon our own portfolio and what we're seeing is specifically as the nature of injury breakdowns, the majority of claims that we do see are musculoskeletal, body stress injuries that are being experienced by workers in the Tasmanian scheme. About 14% within our portfolio experience coming around wounds and lacerations injuries that we have, and 12% also in mental health injuries. So these are areas of focus that we look at. We look at how we can manage the primary care, but also how do we support workers and employers in this industry to help better equip their risk management in looking after their people. One area that we know is, in our observations, is the growing trend and the increase in operations for this industry. Within the aged care residential services, due to obviously the ageing population, it's projected to drive the industry performance over the next few years. And industry revenue is projected to rise by an annualised 5.3% each year. And of course, that's going to be impacted by further regulatory reforms, potentially higher wage costs, which will present another challenge for this particular industry as well. When we look at the community services and assistance industry, again, this is led by agreement around government policy and associated funding, which is likely to determine the industry performance and over the next few years, and obviously driven by schemes such as the NDIS. So we are seeing this, and of course it's through the rising demand for industry services, and we've projected to support newer firms also coming into this industry over the next few years as well. Through this, many of those new firms are forecasted to be for-profit businesses as well. Traditionally we see a lot of within our own portfolios as non-for-profit organisations, but what we are seeing projection of for-profit, businesses that operate in this area as well. So less reliant on volunteer labour, but obviously more on direct employed labour, which of course are higher worker exposure, so deemed workers under the Scheme Act as well. So we're going to be seeing a higher growth in both of these industries over the next few years. So more exposure, which is a great, we're seeing a great determining industry that is growing quite quickly, and how we support an industry through that growth is something that we're keen to do and keen to support. When it comes to looking at the types of emerging risks that we are seeing within our own portfolio and more broadly, we wanted to kind of hone in on a few that we are seeing as major trends. Obviously, secondary employment, we do see that as an area that is growing. I've just drawn on from the Australian Bureau of Statistics that as of June 2024, 9.8% of workers in the personal community service workers are most likely to have multiple jobs. And through that can result in workers working on different ways, working casualised, part-time, and through different employing agreements and employee platforms that we know as well. So with that, of course, comes some risk. When we look at from a worker's point of view, one big area of risk is obviously managing worker fatigue. We're managing how workers are employed across multiple ways and how many hours they work a week, both because fatigue can obviously have an impact both physically and mentally, and that can contribute to potentially workplace injuries. So how employers are managing how workers are engaged and employed is something that we always definitely encourage organisations to look for. One other area that we do see within our portfolio experience is mental health injuries. 51% of mental health injuries in our portfolio are occurring in the healthcare and social assistance sector. And again, the types of claims, it does align to the National Safe Work Australia data for serious claims within the healthcare and community care sector, where work pressure exposure, work pressures, workplace occupational violence, and worker-related harassment and bullying definitely make up a fair representation of the mental health stress claims that we do have. And on that as well, obviously isolation risks in the psychosocial risks as well, because people are working out in the community and sometimes are working by themselves. So that is another compounded risk, a psychosocial risk that we see within our portfolio, and something that is employers, how do we manage those psychosocial risks? How are they documented within our organisations, and what can we do to mitigate some that's going to cause potentially workplace injuries to occur? The last major emerging risk that I wanted to kind of touch on as well is driver safety. Within our portfolio, within Tasmania, or across the board, 39% of all workers' comp claims lodged for a vehicle accident are occurring from this sector as well. And through that vehicle accidents, 27% of workers that have a vehicle accident usually result in having multiple injuries. So getting people back to work and managing those workplace injuries sometimes can be complex, because you're dealing with both different types of injuries and potentially psychological injury as well when getting people back to work. So from a driver point of view, how businesses are starting to investigate and look at how they manage their fleet within their organisations. What do they look for in relation to key competencies, and again, things like fatigue management do come up in relation to making sure people when they are on the roads going between customers, how that's being assessed and maintained. So it's definitely an area of focus that we see within this organisation or within this industry. Through that as well, with driver safety, there is also how businesses manage workers on grey fleet. So grey fleet is when workers are using their own cars to get into customer or clients, throughout within the community. How are they being managed? Because that is also a workplace in managing, vehicles. So even though they might be their own vehicles, what kind of balances and checks do employers put in place to ensure that that's a safe system of work as well? So this is just wanted to be a few larger emerging risks that we are seeing within this particular industry. And obviously they do have impacts to compensable claims that we do see. And now I'm going to pass you over to Marcia, who will talk about the emerging claim trends that we're also seeing in our portfolio. Over to you, Marcia.
Thank you so much. Thank you all for joining today. It's a real pleasure to be here to present to you. I did just notice somebody had a whirring noise, so I hope that is better for you all and you can all hear me okay. But if there's any concerns, just pop it in the group chat and we'll look into it. Thank you so much. So I wanted to just firstly today talk about a claims overview for our scheme here in Tasmania. In Tasmania, we have seen over 7,000 plus injuries reported in 2022. What I would like to say is that 23% of all of those serious injuries recorded are actually in the healthcare and social assistance industries. Almost 1 in 4 workers seriously injured in 2022 worked in healthcare and social assistance industries. So we take a real deep look into what we can do to actually prevent some of these injuries, and Michael has touched on some of those areas around risk management. The claims will arise out of these industries, and I want to talk today about some of the emerging claims trends that we see and how we can work together to support our injured workers navigate the workers' compensation system. Some of the emerging claims trends that we are seeing from a worker's perspective, and I think that we can all agree that financial hardship and uncertainty when making a claim can be at the forefront of actually injured workers getting back to work and back to life. It's always an area of concern for an injured worker. We also see that ongoing stigma around making a claim for workers' compensation. And we want to ensure that when an injured worker is needing to make a claim, that they're supported in a safe and caring environment. Returning to work with multiple employers through casual contract work has also been something that we have discovered emerging through the Tasmanian portfolio of workers' compensation claims, especially in the healthcare sector. What we're seeing is that the casual rate of employment here in Tasmania is actually making employers employ on a casual basis workers then needing to take 2 jobs. with two separate employers, working potentially 20 hours with one, 20 hours with another or more. This is actually causing stress within the workplace and can also lead to that increase in workers' compensation claims being made. We're also seeing a number of secondary psychological injuries come through our portfolio and secondary physical injuries. Now, secondary psychological injuries are having an impact within our scheme. What we are actually seeing is that those claims that are developing that secondary psychological impact are actually costing between 3 and 6 times more than a normal claim that we see come through for a physical injury. Secondary psych is actually on our radar at the moment, and how we can prevent that through supporting our injured workers return to work and return to life. And we'll talk about that a little bit more as we go through our pack. Workers in Tasmania are experiencing numeracy, literacy and language barriers. And so we're looking into how we can actually support and coach our injured workers through those barriers that we might see when a claim arises. We're also seeing access to healthcare as one of those main emerging trends, with getting timely access to healthcare, especially in that psychological space. We are seeing some significant wait times, significant wait times in getting access to healthcare. And that fear of losing employment following a claim is something that's emerging from workers as well. So today we're going to talk about some of those impacts and how we can potentially work together to actually support and encourage our injured workers through the workers' compensation claims system. From emerging claims trends, from an employer's perspective, what we are seeing is an emergence of small, medium enterprise claims, and those small, medium enterprises having capabilities to manage workers' compensation claims. It can be a difficult space to navigate, and we don't expect everybody to be aware of all of the intricacies when it comes to a workers' compensation claim. So what we are seeing is the need to support our small and medium enterprise in navigating the workers' compensation system and supporting their workers back to work. Employers are also faced with an ageing workforce and how we're actually navigating that in our system as well. How workplaces are actually set up to support people when they are actually coming to the end of their working life, their working career. And that will be something that I think has been impacting and will continue to impact in our workers' comp scheme. We're also seeing an increase in labour hire, employers actually bringing in labour hire or being supported by labour hire organisations. We're also seeing an increase in unsupported return to work from some of our employers. So we really want to hone in on how we can support our employers in facilitating those early interventions and early return to work for injured workers. We're also faced with a reduced workforce here in Tasmania, and I think that that is something that is impacting, and it's increasing the need for labour hire in Tasmania. And increasing operating expenses for employers is a significant concern. When we do see workers' compensation claims flow through, we are also seeing that impacting on employers when it comes to increased operating expenses. Emerging claims trends in our healthcare sector are timely access to healthcare. We all understand that booking in with our GP sometimes can be a significant wait time. When you've got a workers' compensation claim, that is often no different. So that is an emerging trend that we're seeing come through. Medical management for progression on claims. You may very well have an injured worker that has attended a GP, but then that follow-up allied health through a physio or a psych may be delayed. So that is an area that we're also aware of. And just working and navigating in the scheme can often be quite a daunting experience for our healthcare professionals to navigate and support injured workers. And so today we're going to talk a little bit about how we can all work together to collaborate and support each other through that journey. Firstly, though, I'd like to touch on the secondary psychological impacts. Recovery timeframes, returning to health and returning to life, is certainly one thing that we're seeing impact on secondary psychological matters that flow through our portfolio. When we have somebody with ongoing chronic pain, lack of perceived workplace support, ongoing impairment due to their workplace injury, uncertainty for the future, family breakdown, financial impacts for both the worker and employer, they can all be significant flags for secondary psychological impacts. When we talk about secondary psychological impacts, that's the psychological impact that we see form following a workplace physical injury. All of these things that we see impact, we need to identify and support injured workers navigate these barriers as quickly as possible. And it doesn't just start with when we get an insurance claim. It starts across the value chain when it comes from the injury that's reported to the employer, from the time it actually gets to the insurer, also engaging with the medical professionals to actually get a plan to support an injured worker navigate any symptoms that they're seeing through psychological impacts of their claim. A little bit about how we actually identify and manage our claims to try and ensure that we're quickly and effectively supporting injured workers with their initial claim and any secondary injuries that arise from that claim. It's really important as an insurer that we actually have initial and ongoing claim screening. And a lot of that is done through general conversation with our injured workers and our employers to identify any of those barriers where we need to overcome in supporting an injured worker back to work and back to life. Within many insurance industries, what we do see are leadership triangles, where a claim is actually managed by a claims manager, an injury management advisor, and also a technical person within that insurance company. That actually provides the appropriate level of guidance through that injury management and claims management process. That works very effectively. Some insurers also look to implement screening tools with a specific process around asking injured workers and employers questions to ensure that any barriers are identified early. That also doesn't need to just start with our insurance claims. It can start from the time of injury. The earlier we identify any barriers that we need to overcome to support an injured worker, the quicker we can actually get a plan in place to make sure that that injured worker is set up for success when it comes to navigating the workers' compensation system and their recovery. Outsourcing for rehabilitation support, it can be a fantastic way of ensuring that there is full collaboration. Having that additional support for an injured worker and an employer can often be so valuable, especially when it comes to significant claims. An outsourcing for rehabilitation can actually take care of screening for us, provide us with some depth to any barriers, attend GP reviews, and actually collaborate the whole injury management and return to work process for us. The rehabilitation and claims advisors can also make sure that they're working together to navigate the right care at the right time, ensuring that our injured workers are actually fully supported quickly and effectively, and a plan is in place to make sure that they are actually getting all of their care at the right time, such as physio and psychological support and assistance. Also leveraging from the clinical framework for the delivery of health services, ensuring that the care that's being provided is actually aligned to some goals and delivering the appropriate outcomes. Medical management planning and recovery monitoring is so important, making sure that when we actually have a plan in place to support an injured worker, that plan is actually seeing some good measured goals and that there's progression throughout that journey for that injured worker and the employer. But the big part around all of the support that we can offer from an insurer's perspective, an employer's perspective, and engaging with our medical and allied health professionals is communication, coordination, and collaboration. That is where we see the most success when we're managing a workers' compensation claim. So the use of the screening tools from the employer, medical management, allied health support, and the insurer all collaborating together to make sure that there is an appropriate plan in place to support injured workers. Regular planned communication in a safe and open environment on a regular basis is so vital. That is the way that we can actually support our injured workers navigate our workers' compensation system and remove any of that stigma or concern that an injured worker may have. That can all be done through a plan, an appropriate plan and appropriate communication. We see the most positive outcomes when there's a plan in place early to support an injured worker, when our claims advisors are supporting our employers to actually get those plans in place. And we're doing that in a safe and secure environment where an injured worker feels safe to come to us and talk to us about the plan, talk to us about any concerns that they have, and we can identify barriers. Barriers can arise throughout the process of a claim. Early intervention, as I've talked about, is so vital, and we can actually see that employers that have an effective EAP support system are providing psychological or counselling services, and getting a mental health plan in place early for injured workers is something that will actually minimise the duration of claims and provide that appropriate support. Planning ahead and collaboration and understanding of return to work plans. So vital, not just to produce a piece of paper that's provided to an employer and an injured worker outlining a plan, but we're not following that and we're not understanding what that is. So sit down and talking those plans through is just so important. We're seeing some great outcomes through that communication, that talking through those plans and making everybody understand what their requirement is through that injury management process. Collaboration is key. Injured workers, healthcare providers, employers and insurers all being on the same page. When that happens and we can identify barriers early, we can get some fantastic positive return to work outcomes and getting our injured workers back to work and back to life as quickly as possible. Sometimes we do have to think outside of the square when we're looking at managing a workers' compensation claim and looking at alternative offerings of support through exercise programs, travel arrangements and home help. They can all impact on a claim's success. So how do we get there together? As we've talked about today, the big impact is collaboration, communication, and talking to each other through this journey. Ongoing capability support through training offering within the industry. So at GIO, we encourage ongoing training for our employers around injury management, return to work options, and we're always supportive of leaning in and helping in that way. Employers' capacity to manage workplace injuries from the day of the injury. That is something that is so important, to have a plan in place on how employers are actually going to help an injured worker get back to work and back to life, but most importantly, get the healthcare that they need quickly and effectively. And also not forgetting their financial burdens and financial impact, and ensuring that that weekly compensation is paid in line with the regulations. Insurer support to provide education and training to key stakeholders is key. As an insurer, we can provide so many valuable opportunities for training, and that's something that we can do together to uplift the capability within our industry. Keeping our injured worker at the centre of our decision-making process, that is vital. When we're seeing a workers' compensation claim, it's key to make sure that all of the decision-making centres around our injured workers. and then continuing to make moves to improve our industry through collaboration and forums. I think that we can leverage such capacity and capability from each other when we all work together to see the scheme improve. And as I've said, we improve together, so collaboration and communication is key. And thank you so much. So I will hand over to Dr. Mary White.
And I'm going to have a go with my video on, but I think it's already lagging. It's just the bandwidth here. I've switched to a hotspot, but I'm not sure it's okay. Can you hear me okay? Great. All right, I'll continue on, but just shout out if it's no good and I'll turn off the video. Lovely to meet you, everyone. We're pleased to be sharing today's discussion with you. So I'm going to talk a bit about the health side of the healthcare industry, and my talk's going to be a bit longer than the others, and I'm also going to give you background to the It Pays to Care policy. So first up, I'm an occupational physician, and the community we serve is the working or would-be working population. And what we see with the community we serve is poorer outcomes for the same condition of the same severity as in non-compensable circumstances. And all the evidence says this is what happens as well. So here we are spending extra money on work injuries to give people extra treatment and help them back to work earlier. And unfortunately, across the country, I'm not talking about Tasmania, but across the country, outcomes are worse. So that's a major issue for us, for our population. And then the second part of it is sometimes that those bad outcomes lead to people being out of work long term. And that's bad for our health. We lose our structure, we lose that automatic connection and activity levels that are needed when you've got to get in the car or, get on the bus to go to work and be, somewhat active at least. So those two things have led us to focus on this area now for a long time. Many of you may have heard of the Health Benefits of Good Work policy that came out from the college. That was 2010. It had a lot of traction and was used, but not sure it helped us look in depth at work injury schemes. We've developed another policy which was launched in April of 2022 called It Pays to Care. And there are two main papers. So there's the values and principles paper and then a longer evidence-based paper. So the values and principles, pretty quick and easy read. It just talks about the importance of values and important principles in our schemes. And if we look across the country, particularly in the two most troubled states of Victoria and New South Wales, we do see that values matter. And we're all a bit cynical about values because we've seen them talked about and then, money or other things get in the way and those values are not upheld. They lose out. And so while we're cynical about values, if you really look across the world, they make a huge difference. If we trust each other, we are better as a society. Example, during the pandemic, we had better economic and health outcomes because we are a society that more or less trusts each other. A bit less post-COVID, I might add, but so these things really matter, and they matter in work injury schemes because trust is often missing. And again, I'm not talking about GIO or Tasmania, I'm talking more generally, and I'm a Victorian, so I come to this a bit slanted with all the troubles of Victoria. But as Marcia talked about, the collaboration is really important. And the industry does seem more interested in collaboration now than it was, say, 5 years ago. So, collaboration between the physio and the GP, between the GP and the case manager in the workplace, the doctor in the workplace. All of these collaborations make a major difference. And I'll show you a slide later that if you're missing one out of the three key elements, you're probably going to struggle, or you will have difficulty. And if you're missing two out of the three elements, you're probably really going to struggle. The second, just going on about the values and social capital, When we trust each other, you know this from the people you know around you. You might like fully trust your next door neighbour with everything, and, you know, they ask you to come in and help build the carport. You'll go in because you've got that great relationship. You trust each other. You know the people in your lives who you don't have that same trust for, whether it's a work colleague or your cousin or whoever. And you know how you'll be stilted in those conversations and hold back, or you won't fully express yourself. We behave differently when we don't trust others, and this is a human trait and normal. When we are treated well, we respond in kind, and when we're treated badly, we respond in kind. When our supervisor's kind of been nonchalant and kind of brushed us off, we will respond in different ways, but we will feel that, and at some point, there's every chance that will come out in some way, shape, or form. Reciprocity, the response in kind, is the most widely consistent aspect of human nature across societies and across time. So we kind of throw these things out the window when we talk about work injury management, but these are fundamentally vital and important and make a huge difference. Trust from GPs is low. This is data from Victoria. 27% of GPs believe the employer will stick to the restrictions. Now, whether that's true or not, that's what they believe. And, you know, when there's stuff happening and psychosocial stuff, GPs will have a tendency to protect their patients. They don't want to send them back to environments they don't trust. So, again, these things have a huge impact, and particularly if we think about healthcare environments. So the evidence-informed policy paper, I would encourage all of you to have a read of it if you have an interest in this area. It's a longer document, about 180 pages, but it's not a difficult read. People tell us about 3 hours. You know, a lot of people don't read every word because you know, some sections will be less relevant, some will be more. It's been read by case managers to CEOs and board directors, and I think people have found it valuable. And I understand that I've spoken to the board, and they found it valuable and are using it actively in Tasmania to discuss the scheme and potential changes. So it's evidence-based. It looks at the whole scheme. It looks at the role of the regulator. It looks at the role of case management, and not just the case managers, but the background support they have, because they can't be good unless they've got systems that enable them to work well. It looks at the role of the workplace, the really important role of the workplace, and the role and what happens in healthcare. And it calls for long-term thinking in this area so we can develop learning. So let's just now talk about a case study, a case example of a not uncommon type of problem, mental health problem, but we could see the same in physical conditions, and how it can go not so well if we just don't get on top of it early. So Lisa's in emergency in a hospital environment. She's a nurse. She's had a run of aggressive patients. She hasn't been assaulted, but she's been abused by a series of patients over 2 weeks. And she's pretty experienced in emergency, but this knocks her off her perch. She doesn't want to make a big deal about it because everyone has this problem in the emergency department, but she starts getting anxious and doesn't say anything because it's kind of like, well, everyone else is facing this. Why should I make a fuss? Tries to keep going with work, but struggling, and starts to have poor sleep at home and more worries, becomes hypervigilant at work, and it's starting to affect her work performance, her efficiency and ability to concentrate on the job. She's starting to think about leaving her job. It's really just become a bit overwhelming for her. So when we talk about work injuries, a huge part of the problem is psychosocial barriers. Now, if somebody's off work for the long term, not just that I've strained my back and I'm off for 3 weeks, or I've got carpal tunnel syndrome and I need surgery and time to recover, but that's sort of I've got a sore back and I'm still off work 10 months later. The vast majority of the problems are psychosocial in nature, beliefs, how people are treated at work, what they understand about the situation, confidence levels, etc. Now, we've got fairly good data on this. Here's some data from New South Wales in the chart on the right. This is an approach where they undertook a questionnaire, a psychosocial screening questionnaire, which was administered by phone by the case manager within a week of the injury. For those of you who are not familiar, this tool, the Arebro Pain Musculoskeletal Questionnaires, probably been the most widely used tool in Australia, and a lot of physios have used it over the years. But what they did was they measured their psychosocial barrier or factor level at a week, and they identified those at elevated risk. So the Arebro is a score out of 100, and they set a cutoff score of over 50 as elevated risk. And what you can see here is when they measured the time off work, I can't remember, it was 6 or 12 months later, but those in the elevated risk group had 3 times the amount of time off work than those in the low risk or under 50 group. Now, that's a pretty powerful predictor. We're talking about AI and machine learning and there's been algorithms and all sorts of ways of trying to predict who will be the more troublesome claims where we should focus on extra care. But of all of the information I've seen, this is the most predictive. And it's obviously pretty simple. It can't be determined before the injury. It's about where they're at a week after. And what we're looking for, what the screening questionnaire is measuring, is anything along these lines. There are psychosocial barriers everywhere. We all have them. Like, we go to ask for a pay rise and we're like, might be, what's going to happen if they say no? So that might put us off, or I don't like talking to my boss, or maybe I'm not worth it, or whatever. All of these things in our everyday lives impact our ways of thinking, our communications, and our thinking has a huge impact on what happens. And we've known about this for thousands of years. In the old, 2,000 or 3,000 BC, yoga sutras that were written about yoga and meditation that was talked about. We know that our beliefs and our thoughts have a tangible impact on what happens. So if we're low in confidence about our condition, us healthcare providers introduce all sorts of barriers. We tell people they've got a disc degeneration or a tear in their shoulder versus bursitis. And so these things have a lot of meaning for patients, and we have good study data to say these things have a negative impact. Randomized studies have shown people who have an MRI of their back have worse outcomes for the same condition. So we introduce a whole bunch of psychosocial barriers that have real impacts. People believe they've got problems. We medicalise. Personal factors, passive approach to treatment, low self-efficacy, adverse childhood experiences, anxiety in the past. And then there are all sorts of scheme barriers that come in. The 2 most common barriers are lack of confidence in ability to cope, so passive coping, and then the other is workplace issues, workplace barriers. They're the 2 most common. And so if we don't address these, we can say there's a very good chance we'll have further problems. The longer time goes on from the injury, the more we can all say, there are psychosocial barriers here. But the difficulty is, by this stage, they can be set in concrete. 6 or 12 months, they're much harder to turn around than if you get onto them early. So just continuing this theme of addressing psychosocial barriers and how important it is. So this is a follow-up to the study I showed you before, where they looked at the high-low risk groups. What they did after that was they went on to do a study looking at public hospitals in New South Wales, and they separated them into hospitals where they put this new intervention and new approach in place, and control hospitals where they just had the normal, usual care. And what they found was, when you identified those psychosocial barriers, and people took up the offer of counselling, which only about 50% of people did, These are the results you see. So there was a 30% reduction in claims costs, but more importantly even, hardly any long-term cases beyond 30 months, no costs. Slightly higher costs because there was counselling at the beginning. The counselling was up to 6 sessions, maximum, but the average was 5. So very pragmatic, focused counselling, not sort of deep and meaningful long-term counselling or sort of supportive counselling. It's very targeted, empowering, helping them work out, navigate the system and how to deal with it. And there was also some extra healthcare support for the GP and extra workplace support through the Return to Work Coordinator. And I have included links in the second last slide to more about this study and also the replication of this study at Australia Post if you're interested to learn more. So these are just some of the results from the Australia Post study. They put the same thing in place with some variations, like for psychologists, they used their EAP providers rather than local psychologists, because you can imagine Australia Post, they're not necessarily going to have a local psychologist in the middle of the Kimberley, where they will have a postman or woman. So they've had significant improvements in time to return to work, time to from the claim being open to return to work to full duties and to any return to work hours, significant improvements, reduction in costs. They were a bit surprised, but also a reduction in incapacity and medical treatment costs. They thought because they were offering and fostering early proactive evidence-based care, that resulted in less need for more complicated procedures down the track. And there was high levels of worker satisfaction with this. It's not like people were saying, you know, we're limiting your treatment. They were really helped in all sorts of ways. And just going back to what Marcia was talking about, so at GIO, they've got experienced people looking at the claim from the start. But really, if we look across the country, a lot of case managers are relatively new. And so when you're not experienced as a case manager and you're dealing with this claim by yourself, which is often in some jurisdictions the you know what happens, then you're not really good at picking up psychosocial barriers. Experienced people can get on and do it really quite well. They just have an ear for it. But if you're not experienced and you don't have the confidence, then this tool brings everyone up to the same level. So the key elements of this approach are risk rating to find out those at elevated risk, extra support for those at risk, particularly targeting the particular psychosocial barriers. You can't just say everyone has the same counselling. The elevated risk is just a screening, and then you've got to find out what the particular person's barriers are. How do you use further information to learn about that? And I mentioned earlier, you want the whole system in place. So you need your workplace, you need your case management and your healthcare. If you've got all three working together, you're pretty much home and hosed. If you've only got two, you're going to have to work harder and you may not get there. And if you've only got one out of the three, you're probably not going to get there. So you really do need a collaboration, as Marcia was talking about. So if we just go back and look at the systems of work, because that's what I'm moving on to now, what we see in Lisa's case was we don't see a system for early reporting. You know, I'm obviously going to give you a sketch of the case, but there's no system in place for early reporting, and there's no really focus at the workplace. I will turn off my video because it seems to be doing something funny. I just gather my thoughts again. So no, really encouraging people to report early. Don't wait. If you're feeling off balance, tell us early. We'd rather help you early. So that was missing. There was kind of no then assessment for what's happened and how it could be dealt with, and early getting on to perhaps change in duties. There's no clear peer support program in place. There was no family support or broader support network, no communication about job security. She's starting to thinking about, can she stay in this job? And no evaluation of other safety protocols and de-escalation techniques in place, and are people using them, and do they need upgrading? So all of these things have really been missed because there's not that real focus on early reporting. And so I would say that's a workplace psychosocial barrier. And so if we just look at what great looks like, and I'm sorry for the tiny text, but early reporting systems in place and people being encouraged to report, and that being the standard behaviour. Now, I've heard people talk about, oh, yeah, but if you do that, you'll just get lots of claims. And if you encourage reporting, you'll get lots of claims. And I've been in workplaces where we've introduced this as a system. Visi, district nurses, aged care facilities. When you put a clear system in place and follow it through with implementation, you do get early reporting, but you've got to encourage it. And you might get a slight increase in claim numbers. That's what we saw, because people have had problems and now reporting them. But you get a long-term reduction in problems because you're dealing with them early, so much easier. So what would have been great for Lisa was, after perhaps a week or two, she felt there was an issue and she'd report that. And that was taken seriously. And there was, clarity about, did she need extra support, providing that extra support, the counselling, peer support in the workplace, flexible work arrangements, perhaps taking her off emergency for a spell, putting her on the ward where there's less aggression, and then review of the safety protocols and how everyone else is dealing with aggression, and are they all okay, feeling okay? So sort of dealing with it like a sentinel case. We talk about a sentinel case in occupational medicine as one case which tells us we must look deeper. So if we see a case of silicosis at a workplace, we need to look deeper. It's a sentinel case. Maybe it's a pretty good chance others will be affected. And so if all those systems are in place, what we see with Lisa in a different scenario, she feels supported. She's starting to feel less anxious because she kind of gets, I can manage it. I've got some techniques now. I can breathe through it when I get a bit, over anxious. She's got a lot of support from people around her. She's exercising because she knows, and evidence is that helps her mental health, starts to get a build of confidence, gets back to social stuff. And gradually gets back to her job, becomes an advocate in the future for mental health awareness, and recognises she loves the job and she wants to stay in it. So let's talk now about the workplace. I'll just start by talking a bit about case management, and this is talking about insurance case management. So this is again from the policy and talking generally. So case management makes a difference. People who feel they have good case management have higher return to work rates, report less pain, they feel better, and they recover quicker, and they report improved quality of life. The difficulties for case managers, and we have this in some jurisdictions, is there's high turnover, 40%. I'm sure that's not what it's like in Tassie, but in some of the jurisdictions where there are difficulties, 40% per year turnover is massive, and it's very difficult to improve the quality of case management with that level of turnover. We've got good data now from a range of places that tell us if a case manager's been in the job for 2 years or more, they get better outcomes. So if there's such turnover, it's a real challenge. And there are many other challenges, particularly in the public systems. So just going on now to talk about the workplace. The workplace is, if you look at all the evidence, the biggest influence on return to work. What you see on the right is what's called a slope graph. A few years ago, I was fortunate enough to be able to analyse the Return to Work survey for Safe Work Australia. And that's a gorgeous database of interviews of people who've had a work injury. And it's done around the country and every few years. And it asks about their return to work experience and what's influenced their return to work. And what we see is you can bunch questions together. Statistically, that's okay. I've done that. And you can see when the worker says their employer tried to do the right things, they made contact early, tried to provide suitable duties, tried to help them, was fair. Return to work is 87% for physical injury claims at the time the survey was done versus 62% for when the worker said the employer was negative or less than constructive. And the same applies for psych cases. So, the workplace, if we looked at all the other charts, healthcare, we barely make a difference, really, in terms of the slope graphs. The case managers make a difference, but the workplace is the greatest impact on whether somebody comes back to work. So let's delve into this in more detail. This is another study which looked at the role of doctors versus return to work coordinators. And what it found was we do okay. We help out in shorter duration claims. And they're the ones typically that are more biomedical, the fractured arm, the back strain that gets better, just over time. But once things go on 3, 6 months or longer, and this happens for like all injuries, whether minor or major, but the extent of it is the proportion of impact is greater for the minor injuries on psychosocial. I'm not explaining that well, but even people with spinal cord injuries are significantly impacted by psychosocial factors, but it is a greater proportion of their disability for the everyday musculoskeletal and psychological complaints. So return to work coordinators at 6 months, the chance of the person being back at work was heavily influenced by non-stressful encounters with the return to work coordinator. So if the return to work coordinator was helpful and positive, the chance of return to work was double. We come nowhere near that as doctors. So 5 golden workplace opportunities, 5 areas where if you went back today and you wanted to improve your workplace, these would be the areas you'd look at and identify whether you could make improvements. So injury reporting, that early intervention, particularly identifying those who are going to benefit from extra supports, workplace culture and prevention of psychosocial hazards, the supervisor, the line manager has a huge impact, and senior management engagement. So key elements of injury reporting systems. There's lots of different ways. Might be report to your line manager, report to HR, might be electronic form, might be report over the phone, might be report by fax. Around the country, there's a bunch of different ways. Really, what you want is a system that encourages day one reporting. And you have to be active in getting that into place. You can't just tell everyone and let it happen. You've got to monitor it, review it, look at the data, and speak to the people where it's not happening to make sure it's put in place. It needs to be personable. It needs to trigger early rehab and early care. It needs to work for the person who's reporting the problem. They need to feel they've been heard and the important things have been discussed. And cost centre allocation, I'm a big fan of cost centre allocation if your business is big enough so that you know where your claims costs and problems are coming from. So if you've got a series of hospitals, which hospital, which department, is it emergency, is it Ward 2A? So you know where your problems are coming from. Is it from home care? Is it from home care in this region? It helps you track down what are the barriers. So good early intervention, of course, as I mentioned before with Lisa, depends on knowing about the problem. If you don't know about the problem, then you can't get on and deal with it early, which is really what you want. 2 weeks is not early. 2 weeks, a lot of things are already starting to happen. Beliefs are setting in, relationships are changing, worries are there. So, you really want to get in as soon as you can. And you want to engage. You want the healthcare provider actively engaged and trusting you all. And that means the employer has to be helpful. So psychosocial, psycho what? Now this is about 10 years that term popped into my brain when I read an article. And we're a lot more advanced in understanding what psychosocial is these days, but largely because of the prevention of psychosocial hazards legislation. But just again, let's talk a bit more about psychosocial. So there are prevention of psychosocial hazards, and then there's early return to work care. Now, I did a webinar with Tassie on Tuesday where I went into more depth about bringing prevention and that return to work care in dealing with psychosocial hazards and barriers together. So I understand there's a recording of that and that should be available. So if you want to learn more about bringing them together, feel free to have a look at that. But if we look at the psychosocial climate, then it predicts many things. It predicts future work conditions, psychological health, engagement with others, likelihood of reporting or underreporting, sickness, absence, so many things, bullying, productivity. And so the culture before the injury impacts what happens after the injury in many ways. And if you can have a better workplace culture and really get your prevention of psychosocial hazards nailed, you are less likely to have both physical and mental health claims. So that's really important. I've talked about early return to work care. Sorry, the heading's moved a bit. That identifying those barriers early makes a huge difference. So when somebody comes back to work in a workplace where there are psychosocial hazards like lack of support, stigma about claims, not necessarily role clarity, organisational change when the person's been away from work, then you combine that with personal psychosocial barriers like worries and loss of confidence and not knowing how to deal with change relationships and frustration, etc., then you've got a lot of potential for things to go off the rails. So again, really vital to get those things right. This is just a chart of one of the tools that are available for measurement. So this is the psychosocial safety climate tool. It's probably the most widely studied, and it's been studied for a long period of time and studied internationally. So I refer to it. But to use this particular tool, you need to actually go through the University of South Australia, which runs this sort of program and research. But there are plenty of other tools, including People at Work, the Safe Work Australia tool, that you can use for this purpose. But I just use the PSC because it's got a lot of correlation and a lot of study. So good culture means you've got a high score, a high psychosocial safety climate score. And what you can see is return to work in the studies that have looked at return to work is so much quicker than when there's a low PSC or a poor culture return to work, a return to workplace. When you've got a good culture, you've got a reduction in claim numbers, new claims coming in, and significant reduction in time off work. You've also got more general benefits of a reduction in sickness absence. Now, the other key thing to say, and this is where you may get traction with your hospital bosses, is that it's not just the workers, the staff of the hospital who have better outcomes when there's a good climate, a good culture, but actually patient outcomes are better. So there are less errors and better productivity and all the things you can see over on the right. Now, we've known this for some years. There's been data from the UK health system, which is divided up into areas or trusts, and they've had data for a number of years showing that the workplace culture correlates very well with the error rate, the adverse outcome rate for patients. So really getting that culture right is important. And I would have to say, if we look around the country, that is a major ongoing problem. some issues that are just very difficult to address, like not being able to get enough staff, but other issues that are just not being addressed because there isn't sufficient focus on the culture and bringing people together for all sorts of understandable reasons. But this risk management approach, as Michael would know so well, comes into its own in this area, and it's something very important for us to be addressing. So the third thing is supervisor engagement. This is the fourth thing, is supervisor engagement and response. So supervisors, line managers, more senior managers, we don't talk about them enough. We've known forever that they make a big difference. We've had international studies saying that training them makes a difference, that we get reduced claims, reduced problems when supervisors are trained. Line managers say they feel more satisfied because they know what to do in their job. But it's still happening rarely in Australia. It's not systematic. It might happen ad hoc in places, but it is really important. So they're in a pivotal position. They can identify problems early. They know their people, or they should know their people, and they can identify when things are going off the rails. They can, with workers' permission, talk to the other staff and encourage them to be supportive. So the supervisors make a big difference. And training them is relevant. We developed online training. It's available through Return to Work Matters, can be delivered by the Return to Work coordinator or done as on an individual basis. You can have group discussions, meetings. You can do on-the-job training. So Return to Work coordinators, sometimes Return to Work coordinators shift their role from being mostly the doer to the leader. So they train up supervisors to do the basics in return to work, and they help out in the more difficult cases or check in on the supervisors that need help. So you can train supervisors that way. I've been involved in organisations where that worked really well. We had regular case meetings and trained them up that way. So a lot of ways you can do it. And then the fifth, and by no means the last important facet of management to get your workplace working well, is to get your senior managers engaged. Now, that's not always easy. If you're a return to work coordinator, you may not have huge confidence to go to the boss and say, we need to do this better, or we need to change our systems at work. But reach out for support, reach out to GIO. How can you get information to use? So it's really worth having them on board. My experience is talking to managers about looking after their people and the effect on morale and all of that helps. But when you talk about finances, that's when their eyes open a bit and, they're in. So, and that's their job, to manage the finances. So it's not like it's a wrong thing, but we want to use all leverage available. So if it's the finances that hook them in, find out a bit, talk to GIO or talk to your insurer about how you can understand the costs and present these to senior managers, or brokers can help you in that regard. The indirect costs are 4 times the amount of the direct costs. So finding casual staff that are more expensive to replace that person, training a new person, the productivity loss that you get from that person being less productive, all of these things can impact the manager's views. You might go to the chief risk officer or whoever is the person who worries about patient safety, and talk to them about the culture and how, if you can get better return to work systems, you can help that as well. And that might help a spin off into the general culture. So, and then I think the other thing about talking to senior managers is talk to them about how they can lead. And it's not that complicated, just being interested, asking their direct reports, looking for annual reports or 3-monthly reports, that they ask about some of the workers. We used to have the CEO of a retail outlet of, 100 stores around Australia and online sales, a reasonably sized retailer, to ring people the day after they had an injury, a reported injury. How you going, Joe? What can we do to help you? And that travels through the workforce like wildfire, that the boss has been in touch and cares, and that then everyone knows and the line managers know. And so that sort of thing tells everyone that this is important, and also them leading in safety. So senior leaders, get them on board. You're halfway there if you can get them on board, because you'll then have your other managers on board, and nothing like that to make things swim, particularly if you've got a problem. If things are not going smoothly, you've got people you can go and call on. If we don't change the way we're managing this case, this person, I think this is going to be a $150,000 claim or whatever. And if we manage it well, we can get the cost down to 30 or 40,000. It's kind of brutal and going straight to the point, but these things can make a difference. Another thing I think is useful to understand what's going on in your workplace is a survey. Now, this is just a very simple one. I'll give this in a Word document to Stephanie to share as she's sharing the other material. And you can put your logo on it and do whatever you want with it, change the questions. There's nothing particularly scientific about this survey. It's just finding out what's going on. So when somebody's put in a claim, give them this survey to fill out week 1. At the end of week 1, at the end of month 1, at the end of 3 months. This is the way you find out what's actually happening. And, you know, sometimes questionnaires are better than asking people directly, because it's a bit anonymous. It's kind of like they're not actually feeling awkward. They do still feel a bit awkward, but it's less. So I'd encourage you to use this sort of thing regularly, and this will help you identify where your gaps are for this person, but more importantly, for your system of operation with return to work. And it helps you also learn about improvements and continuous improvement. So I would encourage that as regular use. A few last slides. First up, this is some of the links I said I'd send you earlier. This was the study in New South Wales, the Australia Post study, and just some data from other organisations who've really done this well. Again, the employer, based at the employer, they've got in and done it. So New South Wales Fire and Rescue, we did a webinar recently with Andrew, who's led this, and they've had some fantastic results by really getting in early and focusing strongly. And this is the last one, was the intervention I was involved with, and we had a lot of things on our model where we just did everything you needed to try and maintain a good relationship between the employer and the employee, and we helped the healthcare providers to streamline and make sure they had good work, good healthcare. And when we did this approach and really managed it tightly, you can see we had significant reduction in days lost from work. And this is across a range of industries. It was about 800 claims with about 2,700 control cases. So from a statistical point of view, research point of view, solid data to say you can make a difference. We didn't use screening. This was 15 years ago. We didn't use screening. We didn't have the evidence on it then, but our case managers were very experienced and they could identify psychosocial barriers themselves. So it does really pay to care. It does pay off. If you get in early, focus on that good intervention, it pays off. Last slide from me, it pays to care. We'd encourage you to follow it. There's 2 links here. There's the It Pays to Care website, where we're continuously developing resources and you can register for updates and information. And then there's our It Pays to Care site on LinkedIn, and our marvellous graphics person, comms specialist, does some fantastic infographics, and they may be useful for you to share internally in your organisation, as well as with other people you're trying to influence. So I would encourage you to follow both of these if you have an interest in further resources and information. And on that note, I'll hand over for questions and back to Stephanie.
No, thank you very much, everyone, for your presentation today. Why it pays to care in healthcare and social assistance sector. So there's time to ask our presenters today, Michael Walsh and Marcia Pegg from GIO Workers' Compensation and Dr. Mary White from It Pays to Care, Royal Australasian College of Physicians. Any questions that you have? No questions at the moment, but
and questions are
just
great. There was a whole bunch of questions on Tuesday, and they're really good. I think they ask away because it helps everyone. The questions you might want to ask are likely ones others want to ask too or want to know.
However, yes, just to share with everyone that it has been a well-received presentation today.
And if you're all too shy to ask now, you can certainly reach out to us at any other stage.
Absolutely.
What are the 6 to 10 good return to work design points?
Michael, would you be best to talk about this in terms of the prevention?
Yeah, look, definitely in the prevention side, I would encourage organisations to start having a conversation of, well, what does a good system look like? How can we look at understanding the management commitment around workplace injury management, but more broadly about occupational systems that an organisation explores. So I think that's the first point, is to look at, well, how's my system growing with the exposure of our workforce? And like what I kind of called out before, this is a growing sector. It's definitely a growing sector within the health in Tasmania, but more broadly across Australia. So how are our systems moving with that increased exposure? So that's probably my first one to looking at from a design point, is how is it capturing the size of our operations and how is it accommodating our size of our operations? I'd probably also look at then, things of management commitment and planning. How do we plan for our injury management systems in our organisation? What does that look like? How do we identify the risks, both in the emerging risks that we've kind of shared, but also the risks after an event may occur? What do those risks look like in our organisation, and how can we accommodate that through the work practices that we can offer? I'd also probably look at exploring things such as training within your organisation. What does good capability look like? When it comes to obviously work health and safety, you might have work health and safety professionals, injury management advisors as well within your organisation. So how can you help them grow in their roles as well within your organisation? Sometimes, in our experience, we've seen people that take on multiple roles in their organisation. So how do you designate enough time that they can provide appropriate care and resources for your people? And this is a great thing about the healthcare and community care sector. It's people helping people. So how can we help that for your own workers in giving them the support they need to do their job correctly when it comes to workplace injury management, and as well as occupational management as well. I'd also look at areas of monitoring and evaluation. So as Mary kind of articulated, how do we monitor and evaluate our own systems in place? What does that look like? What does good look like in that regard? How do we get the appropriate feedback loop back to our management team of areas that we continually can improve? So looking at that continuous improvement that cycle, how can we actually drive continuous improvement in our organisation, and how do we plan for that as our business grows? So there's probably a couple of elements that I'd definitely look to explore. On Mary and Marcia, if any additional points you might want to add there as well.
No, I agree with everything that you said, Michael. For me, it's about being prepared early. Don't leave it to the last minute. A lot of employers can often scramble to find suitable duties to get that return to work in place looking at things to implement within your business, such as job dictionaries, so that you're on the front foot and you're planned to have those prepared to have those conversations to ensure that somebody is supported back to work. So I think it is certainly sourcing that a good reporting mechanism for your business, making sure that injuries are reported early so that you are prepared, and then following that, having a plan to ensure that you have appropriate duties to support somebody. That gives a GP confidence that they're then able to safely return somebody back to work. And I think that as Dr. White actually talked about, if a GP is caring for their patient and they don't feel comfortable that they're going to be supported in a return to work, we can see some real barriers arise out of that. So making sure that we've got everything prepared in those early stages is key for me.
I guess the only thing I would add to what Michael and Marcia have suggested, is my video okay? Can you hear me all right? Yep, circling here, I've got that loop going around in my video, is really that sense of support from the people at the workplace. It's protective. If you feel supported at work, you will cope better with the work overload that's faced in healthcare across multiple sectors, so self-care and social assistance, and you're better able to deal with the general adversity of dealing with problems like difficult patients or aggressive patients. So we've known for decades a supportive workplace is protective. If we look at PTSD, for example, from a paramedic or a firefighter or a health practitioner, if there is a good workplace organisational support and culture, then you get better outcomes. There's less problems with PTSD. So it's just so, I mean, I just use PTSD as one example, but it applies to all conditions. So when you're thinking about job design, really there are challenges in terms of there's only so much you can do in healthcare because of the financial limitations and the people limitations. But what you can do is talk to people and get their input and try and work with them, and they feel it. There was a wonderful study of GPs that I remember. I was in general practice 30 years ago, and there was a wonderful study that came out of what do patients want from their doctors. And 1 to 8 was they wanted the doctor to care, and number 9 was they didn't want them to run too late, and they didn't want them to, number 10 was they didn't want them to charge too much. Oh, sorry, no, I think that might have been something about getting the diagnosis right at number 7. But really, it's they want people to care. We just want that as people. And so even if you're limited in your resources, even if you're limited in what you can do in terms of prevention, if you get that support in your job design, and that is part of job design, then I would say that's number 1, 2, 3, and 4. And then other parts of job design, as Michael and Marcia have talked about, that sort of rotation and doing different things and making sure people understand what's expected of them, and having some system so you're preventing, you've got a security person in emergency or whatever. That's a really vital part of job design, particularly in this sector. And I have to say, if we look across the country, we're not doing well with it at the moment.
Thank you, everyone. And just a reminder to our attendees, today's webinar has been recorded, so do head to WorkSafe Tasmania's YouTube page to re-watch and share this webinar, plus other WorkSafe Tasmania month webinars that we are running throughout the month of October. No additional questions have come through, so I'll begin to wrap up today's webinar. So thank you again to our presenters, Michael Walsh and Marcia Pegg from GIO Workers' Compensation, and Dr. Mary Wyatt from It Pays to Care, the Royal Australasian College of Physicians, for your webinar today, Why It Pays to Care in Healthcare and Social Assistance Sector. Today's
Thank-
webinar has been run as part of WorkSafe Tasmania Month. WorkSafe Month is an initiative that is funded by the WorkCover Tasmania Board. Please head to worksafe.tas.gov.au to see what other events, in-person and webinars that we are running throughout the month of October as part of WorkSafe Month. Please also complete a feedback survey that you will receive as an attendee of this webinar. We definitely value your input with this ongoing initiative. So thank you again to our presenters and for our attendees for coming along today to today's webinar, and please everyone have a safe and healthy rest of the day.
Thank you very much.
Thank you, everybody.